Welcome to Chapter 9, Tooth Morphology, and today we're going to be going over some different points in this chapter to help you on your midterm. So the first thing we're going to look at is the dental arches and how mainly in orthodontics we'll take a look at this later on in the chapters. And the dental arches need to have all of the teeth in alignment, in a perfect arch, in order for the teeth to function properly. So you see here, this is kind of a narrow arch, and so we want to expand it using this expander that has a hole there that has a key that turns it. And once you open that up enough, it'll be a nice rounded arch. Once it expands and there's room for this lateral, we'll engage it with the wire and it'll pull it into alignment for that patient. We have 4 different quadrants. We have the upper right quadrant, the upper left quadrant, the lower left quadrant, and the lower right quadrant. And so quad means 4, and in each quadrant there are 8 teeth. And so when you are learning your quadrants, it's very important, especially when you're doing extractions, fillings, it's to get the right tooth. And so a lot of dentists will say, we're working in the upper right quadrant today. So that way you'll know exactly what to set up, how much to set up for, and make sure that for insurance purposes and charting that you're getting the correct tooth number and arch. We're going to talk a little bit about primary dentition and permanent dentition. So the primary, we have a total of 20 teeth, 10 on the upper, 10 on the lower. And so here we have in the center the primary teeth, okay? 5 in this quadrant, 5 in the other quadrant, 10 total in that upper arch. And so we have the central, lateral, canine, first molar, second molar. As these teeth are lost, they're replaced with the permanent teeth. And we're going to look at an x-ray where in between this stage, you have some baby teeth, some permanent teeth, and we call that mixed dentition. And that is the perfect age to start expansion, phase 1 braces, because they have not yet hit puberty. So things are still able to be moved non-surgically. And so we're going to take a look at that. Here you have your permanent centrals and laterals. There's your canine. There's a baby tooth here. Now, with that permanent tooth, here's the path that needs to go. If we don't get that baby tooth out, then that tooth's going to keep shifting over and damage this lateral root, and that's what you don't want. So, anytime you can tell a parent, hey, there's certain times when your child needs to get their baby teeth out, or else it can hinder that natural path of that canine coming in. So you want to tell them to work on getting those baby teeth out so that it doesn't damage the roots of other teeth. And this is a really good picture. There's a piece of that baby tooth here. You can see that the permanent tooth has started coming up, disintegrating the roots. So you have your osteoblast, your osteoclast. The osteoblast go through and will rebuild bone. So right here where there's a gap, it'll rebuild. The osteoclast will continue to wear away, resorb that bone, and take away the roots so that it doesn't have that strong root system like a tree, and it will be easier for that tooth to come out because it has no stability. And that is the whole design of having that permanent tooth come up in its place. However, sometimes the roots don't want to let go, and when you have these baby teeth that have stronger roots, they'll stay in there, causing these teeth to shift from their natural path. So now we have a tooth that could potentially be damaging the canine, and then you have a lateral here that needs to come up. So these teeth, if they're extracted, the baby teeth are extracted, then these other teeth can come in. So doing a phase 1 treatment, putting braces on these permanent teeth, and then making room for them to come in will save a lot of time later on and potentially keep the patient from having permanent teeth extracted to make room. The other thing in this x-ray I want to point out is the patient left an earring on. So when you're sending this to an oral surgeon or an orthodontist or another general dentist, you want to make sure that all jewelry is removed. A lot of patients will say, well, I just got this ear piercing or this nose ring. The human tissue does not heal that fast. So when you're sending this out, you want it to look as professional as possible. You don't want any glares to get in the way of seeing the tooth image, the tissue image. So make sure you get rid of all that jewelry before taking the x-ray. When we're looking in someone's mouth, the part of the tooth that we can see is called the clinical crown. Now, obviously the entire anatomical crown is there, but what we see we only call the clinical crown. Okay, so those are your clinical crowns. This is one thing I find that students have a hard time remembering is convex and concave. So we're looking here at a central incisor. This is a lateral view. So this is the labial side. This is the lingual towards the tongue. Concave means, think of it like a cave. It's caved in. You know, how we get these words, the prefix, the root word, the suffix. Convex, it's outward. Concave, it's caved in. So when you're looking at a tooth and the doctor says, you know, we're going to look at the concave side, that's what they're talking about, that lingual side that caves in. Or if they're talking about how a tooth has, on the labial side, a concave area, maybe that part of the tooth goes in a little bit. So just to help you remember this, especially for your examinations coming up, there you go. All right, a little bit further in detail, we're going to be doing cleanings and fluoride treatments and sealants. So if you're looking at these teeth, you see the pits and the fissures, okay? So the pits would be these little parts here that go down into a pit, okay? Now, if you think about them eating Starburst now and laters, especially we just had Halloween, this is a great time to get kids into the dentist, get those sealants done to fully clean out those pits and fissures and seal them just like you do concrete. You know, you seal your concrete before the winter storms so that they don't get damaged. If we can preserve these pits and fissures and occlusal surfaces of the teeth, then they're not going to get cavities. So all of this is preventative stuff. So these are different landmarks of the occlusal surface, and if these pits are really deep, sometimes we'll take a quarter round burr or a number 2 burr, round burr, and help to smooth them out so they're not as sharp and deep. We'll kind of round them out a little bit. And then you want to do the cleaning, the sealant, and then the fluoride treatment, because you don't want to do the fluoride treatment ahead of time and then now that fluoride is fighting off acid and you're trying to acid etch the pits and fissures and then do the sealants and it doesn't stick, it doesn't bond. That's going to create more problems for the patient. And so making sure you clean the teeth with a non-fluoride pumice, do your sealant, and then afterwards do your varnish or fluoride trace. Okay, the other thing that students have difficulty with is the root system. So the single root is 1. Bi means 2. That means that the root has split, and it's called bifurcated. We get that forcation. That's why, like when driving, you learn there's a fork in the road. It's bifurcated. So it's just like a fork in the road. It's 2 roots. Then you have trifurcated. Tri, like a tricycle, it has 3 wheels. This has 3 roots, 1, 2, 3. And so the upper teeth are either single, double, or triple. Okay, a single root, a double root, a triple root. On the lower, it's just the single roots and the double roots. So you have single root, bifurcated, and trifurcated. On the primary teeth, you will notice they look different from the adult teeth. So here we have mamelons, okay, these little, it reminds me of a steak knife, and the whole purpose of the mamelons is for biting into your food and pushing it to the back so that your occlusal surface can begin the digestion process by physically breaking up the food. Now, as we get older, we will lose those mamelons. And a lot of students will ask, well, why do we lose them? How do we lose them? Over time, kids, have these mamelons. As you get older, you grind your teeth, you hit them against each other, and you can still see them a little bit, but the older you get, the more you're gonna wear down your teeth, just like tread on a tire. And so with the mamelons, it's perfectly normal. One of the things orthodontists do now, if you do have teeth that have a little bit of mamelon left, they'll go ahead and take a finishing burr, like a 7901, and they will smooth the edges and do what they call making it look Hollywood. Nice and straight, and just a little bit easier for you when you look aesthetically at the teeth. The anatomy of this molar. I wanted to go over this because some of y'all had questions about the different layers of a tooth. A lot of people think a tooth is just one solid white piece of calcium, and that's not correct. So here we have the outer layer, which is your enamel. That is the hardest part of the tooth. Underneath that you have the dentin, which makes up a bulk of the tooth. It is softer than the enamel. And the further down you go, it's going to get even softer. So here you have your root canal, and that's where your blood, tissue, and nerves go. And all of this sits in bone, okay? And then the opening to the root is the apex. Along here, you have nerves that pump blood up and down. And so most people that say, I only go to the dentist when I have pain, is really bad, because if you could catch a cavity in this pit here and just do a small filling, or maybe you go every 6 months and you're, really heavy into putting a lot of sugar in your drinks, your iced tea, your coffee, you drink a lot of soda, even if it got down to the dentin, that's fine. You can still do a filling. But once it hits this sensitive area, the liquid part of the tooth, that's it. You're looking at a root canal, you're looking at extraction with implant. So you want to educate your patients on the importance of going to the dentist every 6 months and getting those x-rays, because early detection is the key for anything, whether it's cancer or a cavity. Early detection is key.